All right, we're just a few weeks out from summer now, so some of you might be thinking about working on your golden glow. Well, Emi Chapman is a registered nurse from the Nassif Community Cancer Center. She joins us to talk more about why this is maybe not the best idea to get working on that glow. So, you know, obviously we don't have the year-round warm weather here in Iowa, but melanoma is still pretty prevalent here.
It is. It's actually the 5th most common cancer that we treat here in the area.
Wow.
Yeah.
And that's higher than I would expect, I think.
Yeah, I think it's surprising to a lot of people, but we've just seen a real increase in it, especially in the younger adult population, it seems. But
okay, so is that
everyone?
Is that the group, though, that's most at risk? Is that younger adult? Or?
No, it just seems we're seeing that more and more, but everybody, any age, is at risk for
really?
it. Mm-hmm.
Okay, so you could be 15 years old or you could be 70 years old. And
yep, we see a variety of ages. But
okay, so what should people be on the lookout for? Because obviously, you know, you look at your arms and you think, okay, I've got a couple of dark spots here and, you know, on my legs. Is that is that indicative in and of itself, or what do you need to be looking out for?
The biggest thing that you want to look for is really just to know your skin and know when things change. If something is new, or if it changes. So you're really going to want to look at, is it asymmetrical, the spot on your skin? Has it changed color? Or is it different colors on it? Is it black on one side and brown on the other, or is it just a smooth brown mole? And then also if the borders are irregular, that's important too. If it's smooth and round and it's always been there, always good to still get everything looked at once a year, do a yearly skin check with your healthcare provider, but anything that changes. So the biggest thing we tell people is just know your skin, always know, so that you know if something changes.
Yeah, almost like any other regular preventative exam, just think of it as that.
Absolutely.
Now, obviously everybody hears, okay, you should wear sunscreen when you go out. Is there anything else that you can do, or what should you be doing to help prevent?
Well, as much as you can avoid just being in the direct sunlight, easier said than done, because we all like to be in the sun and we're all outside doing different activities, but sunscreen, very, very important to always wear your sunscreen, always reapply the sunscreen. You know, it's not waterproof, so if you're in the water and coming back out, make sure that you're always reapplying. Hats are great to protect your face, ears, sunglasses. Melanoma can even affect your eyes.
I see a lot of people who have to have tumors, or not tumors, but moles and things like that removed from their face.
Head and neck and ears, that all is very common.
Okay.
Yeah, very common.
Wow. Well, if people have any questions or they're concerned, obviously talk to your medical provider, but is there a place that they can turn to?
Yeah, they can always call the Nassif Community Cancer Center for general questions, and we can direct them whether they would come to our clinic or we direct them to the healthcare provider, but happy to answer any questions for them.
The number for the Nassif Community Cancer Center, 319-558-4876. Thank you, Emi, for being here today. Definitely an important reminder as we get into that season.
Thank you for having me.
Thanks.